Tonight on Doctor's Diaries.
Can you wiggle these toes?
Wiggle your toes, sir. Try. Even I know it hurts. One of the big nightmares in the world is paralysis.
This is not the baby that they expected to have. Okay?
Thank you.
You never want anything bad to happen on any of your patients. But if anything did, he would be one of the last patients I would want that to happen to. And unfortunately, it did.
Cigars are my favorite. I mean, that's what I really miss. Before I died, I'd like to have one last good cigar.
Ron King is rushed to Westchester Medical Center. A construction worker, Mr. King was thrown from his 1,500-pound Bobcat when it crashed through a floor and fell 2 stories.
So what's the story?
Do you know what Bobcat is? Small.
Yeah.
He drove one off a took for a store.
Okay. 2, 3.
Called from the scene by paramedics, Dr. Eric Larson and his trauma team are prepared for the worst.
Is anything hurt you?
Get down over there, please.
Sure.
Sorry. Straighten out your
Anything
arm.
hurt you? Where do you feel
Straighten your
pain?
arm.
Back and my legs.
Could you move your feet? Move your toes. Move your toes. Wiggle your toes.
I could just move this left leg.
Okay, how about the right leg?
So evidently he was driving into some kind of construction site and it went off and had a fairly significant fall, and he got a kind of partially thrown out of it, I think. Okay, can we get some warm blankets too to throw on top of him?
No, thanks.
This guy.
Sorry, and I'm sorry.
Just hold it tight and I can go straight through it.
Blood pressure on the right is 144/96. Can you wiggle your toes? Anybody got scissors?
There's a blade
go.
in my car.
Can you wiggle your toes? Sir? Can you wiggle these toes?
Wiggle your toes, sir. Try. Even I know it hurts. Is it because it hurts or because
It hurts and I can't.
What about this one?
Where does it hurt?
In the back of my calf.
Okay.
In the back of the calf?
Yes.
Okay.
My fingers are tingling.
A lot of times people are in such severe pain because they've either got broken bones or they've got something going on there that they don't want to move. I mean, it's scary to move, it hurts to move, it is intense pain to move, and that's why they're not moving.
With Mr. King in extreme pain, the X-ray technician is called in to help the doctors assess the degree of his injuries.
Thanks.
You know what, we've got, okay, get the collar on. We've got so much clothing here, I think I want to get him off the board.
1, 2, 3, turn. I'm going to get you off all this stuff, sir, and try to get you as comfortable as possible. Try to bear with it for a minute. I'm sorry.
to leave him on the board?
Wait, be careful,
Remove the board first. Remove the board.
Want the board out?
Yeah, board out.
More now. Okay, watch
One layer at a time.
this.
One layer at a time.
Watch this.
Is it hurts here?
Where he's
In your
from.
spine?
Right there.
Here? Here?
Okay, so put it under him.
We're going to have to turn around. You're going to have to push, hon. You're going to have to put a little muscle into this. You guys.
Okay. Just grab the sheet. Grab the sheet. Okay, very good.
right, now
Here we go.
things will be
We're going back. Okay, good. Perfect. Okay, let's get the chest X-ray. Is the ultrasound's ready to go? Beautiful.
Dr. James Lim is the director of pancreas transplant at Westchester Medical Center.
Where are all those charts I asked for? Gosh darn it.
Oh, boy. So tough. On this last day. He's like, gosh darn it.
Something I've always wanted to do. My dad was a doctor, an anesthesiologist. So even when I was little, that's all I knew. That's all I wanted to do. I don't think I'd be good at anything else.
Today, Dr. Lim is performing pancreas transplant surgery on Bruce Phimister, an insulin-dependent diabetic.
first met Mr. Phimister probably about 18 months ago. Came to see me for evaluation for a pancreas transplant. He's a type 1 diabetic, diabetes mellitus. He's had it for most of his life and doesn't have any retinopathy, eye problems, but he's concerned that with all the classic complications that occur in patients with diabetes, something that he doesn't want to go through.
He's had it since he's 13 years old. We carry lumps of sugar in case he couldn't get home to eat on time, or he felt weak, or he did a lot of exercise. So he'd carry lumps of sugar because candy would melt.
His abnormal pancreas produces little to no insulin, a hormone that allows glucose in the bloodstream to enter body cells. Without insulin, his body is unable to convert glucose to energy.
His daily life really, there was always an underlying concern every day in the back of his mind that, you know, I've been pretty lucky so far with my diabetes, but I have days where I can't work well because my sugars are too low or too high. I always need my insulin and my shots with me and my needles. I'm afraid that if my sugar gets too low or too high, I could black out. I could be driving, and I could black out, God forbid, and kill someone or myself. Tony, can I start?
Go ahead.
So, just make a midline incision.
During the operation, Dr. Lim will attach a donor pancreas to Mr. Phimister's digestive tract.
Here's your knife back on your table. Things look good so far.
Mr. Phimister's own pancreas will remain intact, but with limited function. The new pancreas will take over and produce the insulin and digestive enzymes that will allow him to digest food in a normal, healthy way.
I marked this off because sometimes you lose sight of the vessels. Cut here, artery here, vein here. Something I don't know is right here, but this makes it idiot-proof, so for me, it's perfect.
Back in the operating room, Dr. Lim is getting ready to put in Mr. Phimister's new organ.
Mr. Pancreas, I think this can come out. Nice and soft, so at least we got something going in our favor, huh?
Unlike other diabetic treatments, a new pancreas offers Mr. Phimister more than just freedom from daily injections.
Some people think that it's just not having to take the shots of insulin or having to check themselves. That's the main point, the main reason why you should get a transplant, and that's not. That's the least of all reasons. The main reason is because it's going to cure you of your diabetes. The way we do it, we can actually even add on to your lifespan. So, Lori, like I was saying on the back table, I actually have this marked. So when it goes through the rent of the mesentery, sometimes you lose sight of it, and it can actually get twisted, and you don't know it. If I have it marked, I'll know which side is which. Okay, doing pretty good.
This operation may actually help Mr. Phimister live longer. Type 1 diabetes reduces the normal lifespan by an average of 5 years. A pancreas transplant will not only cure his diabetes, but lower his risk of life-threatening diabetic complications, such as coronary artery disease, heart attack, and stroke.
Okay, can I have a 4-0 stitch, please? Okay, so we're just going to start closing. What time will we start? 1:20. 1:20? All right. Now, we'll know probably within the first hour or so, I bet. I think hopefully he'll do well, be very happy, and we're very excited about it. So time will tell.
The doctors have stabilized Mr. King, but before they can give him any pain medication, they first need to figure out the exact nature of his injuries.
I'm going to go elsewhere. I'm going to have to go elsewhere. There's too much scar tissue here.
Good elbow pressure.
have to go elsewhere. There's too much fun.
Okay, okay.
No stick. So try not to move. I know it hurts. Try not to move.
I'm trying not
I know. I'm sorry.
Chem 7. Or you're Chem.
Sir, these are good.
Okay, next priority is get the C-spine.
Put your arms down so I can get them into your neck.
Arms down.
All right, don't resist them. Okay, let them pull your arms down.
I pull it out of your arm, sir. Give me your arm.
Okay.
Give me one. Your right arm.
There you go. Okay, you ready? Okay, let's go. Everybody out. X-ray.
Stretch.
Okay, let's do the ultrasound. Sir, you're going to feel some cold jelly on your belly. We got to make sure you don't have any internal injuries. The ultrasound's very accurate at determining whether there's free fluid or blood in the abdomen or chest. We can look and see, 1, is there blood collected around the heart? 2, is there blood in the lung cavity? 3, is there blood in the abdominal cavity? And if there is, this patient may have to go immediately to the operating room, and that even though maybe their vital signs and their blood pressure and their pulse are all okay, that we need to start transfusing blood right away. It seems like most of his problems are as orthopedic injuries, and we'll take care of that, but we got to make sure the most serious things are taken care of first. As soon as we make sure there's nothing wrong, we'll give you a little more pain medicine. I just don't want to totally flood you or snow you until we know here. Okay?
Yeah. When can I get something to drink?
We just don't want you to drink anything till we know what's going on.
Okay.
Okay?
Well, my wife's a nurse, so I know.
Okay. Okay. I'm just going to be real gentle. I'm going to wipe your lips here. You can suck a little bit of that in. Let me get you clean first, okay?
Okay.
Okay, is that better?
Yeah.
Here, okay. Yes.
I'm going out to a meeting. I'll be back.
Okay.
Okay. What is that guy? Anything?
Yeah, he's got some broken stuff. The only thing is a little bit concerning is he, I don't know what, I think it's his pain, but he says he can't move his foot.
Can't move his foot.
Yeah. So anyway, we'll see. One of the concerns with any kind of fall, especially, and fall with equipment falling on top of you, is one of the big nightmares in the world, and that is paralysis.
How's that hurt so much?
Because Mr. King may have sustained severe nerve damage from the fall, doctors need to determine whether he won't move his foot or whether he can't move it.
This is very important. I know I don't want you to move it much, but we got to just make sure the nerves are working. Can you just move your toes just a tiny bit? That's all we want. Just try move them a little bit. Okay. I know it hurts when you move, but just try. That's good. That's excellent. Keep trying. Now can you bring them up a little bit towards you, or curl them down? Either way. Okay, so there's a little movement there. Yeah. Now, did that hurt a lot when you tried moving your toes?
Yeah.
Okay. Is it you not want to move them because it hurts so much, or is it just because you can't feel them?
It won't go.
Okay. Okay.
Sure, could you squeeze my finger here?
Well, what this gentleman needs is he needs a full spine series. He needs X-rays of all the potentially injured parts, which looks like it's going to be his, right lower extremity and a good portion of his left lower extremity, at least his ankle. That's where he's really hurting.
Mr. King is lucky. He did break a couple of bones, but the test results show that he doesn't have any life-threatening injuries or permanent nerve damage.
Is Dr. Stater here?
Yes, he is. He's in the lab with another patient right now. Okay. He'll be here shortly. My name is Diana.
All right.
Robert Hatcher was first admitted to Westchester Medical Center several months ago after suffering a stroke.
It's early in the morning, and it's common for me to wake up and have my shoulder very numb and the hand as though my arm as though it's asleep. And I had gone down to the kitchen to get some aspirin to take to relieve the pain. And on the way back up, I had to go up a flight of stairs, and I fell because my left foot and arm were numb, and I couldn't hold on. And when I fell, my wife and son heard me fall. They heard the thump, and they came and found me lying there. And we didn't do anything right away because I didn't realize what was happening. And it wasn't until the next morning that we called the doctor, and he suggested we go to the hospital immediately. And after examination there, they determined that I had a stroke.
Robert's doctors determined the cause of the stroke was a blockage in his carotid arteries, the arteries supplying blood to the brain. It has left him partially paralyzed.
Right now, I have very limited movement in my arm, and I have no movement in most of my fingers. I'm just getting to the point now where I'm able to move the fingers a little bit. I still can't move my thumb or this finger, so that if I want to pick something up like a piece of paper with the left hand, I can't do it.
Due to his stroke, Robert was forced to make many lifestyle changes, including quitting one of his favorite pastimes.
Cigars are my favorite. I mean, that's what I really miss. And I've always said that if I ever knew, if I were a person who was fortunate enough to know, or unfortunate enough to know, when they were going to die, and I had the opportunity, before I died, I'd like to have one last good cigar. Hi, Dr. Slater.
Hello there. Good morning.
How are you this morning?
Good. Yourself?
Good.
After many weeks of therapy, Robert has come to Westchester Medical Center for surgery to remove the fat and cholesterol buildup from inside the carotid artery in his neck. First, Dr. Alan Slater will perform a heart catheterization so the vascular surgeon will have an accurate picture of his heart.
In further evaluating his degree of atherosclerotic disease, a stress test was performed, which suggested some moderate coronary artery disease. And therefore, prior to undergoing surgery to correct his carotid artery disease, we pursued cardiac catheterization to further evaluate the extent of his coronary disease.
Okay, as I understand it, what you do is you insert a tube somewhere in the calf or abdomen area and
we insert
thread that up.
That is very similar to this intravenous tubing here, and it's inserted into the artery in the groin area, in the crease of the groin, and through there, like through this tubing, we're able to pass our tubes that go up the main blood vessel of the body to the heart, and we inject some X-ray dye and take X-rays of the heart's blood vessels.
Okay.
And we can visualize this on a TV screen that you'll be able to follow with us.
I've always been healthy.
Active?
Yeah, I played a lot of golf. I've always played a lot of sports when I was younger. I've never seen a doctor except once every year or year and a half to get a physical until now. I've had more doctors in the last 3 weeks than I've had in my entire life. I can't remember their names.
Okay, so we'll see you in a short while.
Very good.
Okay.
Thank you.
Sure.
The morning after Mr. Phimister's surgery, and the news is not good. The new pancreas isn't working properly and will have to be removed.
What went wrong is that there's usually about a 7 to 10% incidence of what's called a venous thrombosis. It's just a fancy way of saying that there can be about a 7 to 10% chance that you can clot where you connect the vein to the vein. In fact, that's the highest incidence of problems you can have right after the operation. And I think that's what happened.
That was pretty sad because I was psyched. I was ready to move on. I was ready, everything was going to go so well. I figured I'd be back in shape, back into living normally. Which would be it would be a nice gift to have a normal pancreas. That's for sure.
You have a certain relationship with each one of your patients. And Mr. Phimister was just an ideal patient. Cooperative, always in a good mood, followed on all the things he needed to do to get listed, just a good person. And obviously, you never want anything bad to happen on any of your patients. But if anything did, he would be one of the last patients I would want that to happen to. And unfortunately, it did. So, yeah, I felt, like I said, I was the second most distressed person in the world that day.
Certain things in life you're under your control, and certain things in life you're powerless and you have no control over. And unfortunately for me, this is one of the things I have no control over. So therefore I accept what God gave me.
And obviously I wish everyone had a perfect ending and everyone lived happily ever after. Things worked well, and every patient who came into the hospital was able to go home and never got sick and never died. Unfortunately, that just isn't going to happen. He knows the inherent risks better now because he's gone through the risks and the complications have become very self-evident with him. So I think what he's going to do, and what I told him to do, is just go home, recuperate, and then if you want to talk, come back and we'll talk and we'll see where he's at that time.
Life is so wonderful anyway. Every single day, I look forward to living. I look forward to life. I do, and I enjoy myself. So that's what I'm going to do. I'm just going to consider my options, and that's it.
It's a frantic day in the maternity ward as a baby boy is delivered several weeks premature. Nurse practitioner Chris Casal and her team immediately wheel the baby to the neonatal intensive care unit.
Here's our boy. Where are we going? Right here. We have a 27-week male baby. I think the mother's 38 years old. I'll have to check that. She presented to labor and delivery with spontaneous premature labor. It just meant her uterus started to contract for really no apparent reason. Her labor progressed naturally. She was 6 centimeters dilated and the baby was in a breech presentation, so dangerous for a vaginal birth. They opted to do a C-section, which is why they called us. We needed to put a breathing tube in the baby in the delivery room because he was too tiny and really didn't make much of a respiratory effort on his own.
The doctors are very concerned because the tiny baby's organs have not yet fully developed.
Got less than pounds too, 1 kilo, oh, so it's good, 1,000 grams. That's 2 pounds, 3 ounces.
Before Chris begins doing any tests and procedures on the newborn baby, she brings the new father to briefly see his son.
I'm just bringing Daddy real quick, okay? All I know is I had very limited time to prepare him, for what he was going to expect or what he was going to find when his baby was born. They knew they were having a boy, and they also knew that their baby was really preemie. And, this is not the baby that they expected to have. Okay, he's actually a good size for 27 weeks, all right? You can see his color's really nice and pink. This is the breathing tube that I told you about.
See his knees bleeding
okay. Yeah, he got a shot in the delivery room, but it's a vitamin K shot. It's standard that every baby born gets that shot, okay? And this is the belly button here where I'm going to put those catheters in, all right? These are monitors that connect the baby to, leads rather, that connect the baby to this monitor. Okay, every baby that's here in the nursery is on this monitoring, intensive and continuous monitoring. He's ready-made poop. See that?
Did he really?
Look, he did. He's the man.
It's funny. He's not as small as I thought he'd be.
Yeah?
I thought he'd be like,
chicken. 2 pounds, 3 ounces. Not bad. He was tearful. He was nervous. He was appreciative of the honesty and the upfront information that he got from me. He just was very anxious about, the outcome for his baby, and, gave me, I understand, and please, do everything that you can. And I think he felt comfortable that the baby was in our hands, and he knew that they were definitely in the right place. So now you got to hurry up and come up with a name.
I know his name.
Stick your hand in here.
His name?
Do you know?
Yeah,
Tell me.
Brandon.
Brandon?
Yeah.
Oh, I love that name. Come on in. Grab his hand.
Can I touch him?
Yeah. Aw, see, he grabbed you. You okay?
I'm fine. Thank you.
You're welcome.
You guys did a great job.
You're welcome.
God, I wish I could kiss him.
You can kiss him. Absolutely. It's your baby. It's true that every baby that you meet and every family that you encounter, you form some kind of relationship with. But this one was going to be different also from the beginning. I think you're kind of almost bonded in a way where you're in a crisis situation with someone 5 minutes before they're going to be going through a life-altering experience. They're going to go from 2 to 3 way quickly, more quickly than they had ever dreamed of. And it means potentially the loss of a huge dream for them. So the nurses are going to be taking his vital signs like continuously now. Okay, and I'm going to put those catheters in his belly button. That's going to take us probably like 20, 30 minutes, something like that. It's like I said, it's a sterile procedure, so we need to scrub up, and we do that so we don't introduce any infection, okay? We'll be doing lots of blood work, and then we're just going to take it day by day, all right? And we'll keep you posted every step of the way. As soon as I learn something, you'll be the first to know.
I appreciate it.
All right? I'm going to go get some stuff,
In preparation for his carotid artery surgery, Robert Hatcher undergoes the first of his procedures, the heart catheterization.
The cardiac catheterization is an X-ray picture test of the heart's blood vessels, where we can visualize the blood vessels from the inside and visualize how well blood flow is passing through those arteries that supply the heart.
Okay, Robert, we're going to begin. So this is the camera that's going to take pictures of the arteries, and sometimes, based upon the angle, we'll get very close. Just let me know if we're actually touching your face.
Dr. Slater injects a special dye that will highlight Robert's blood flow for the camera.
If you'd like to look at that TV screen, what you see there is the catheter that is engaged now in your heart's artery. The arteries will appear dark as the dye or contrast is running through them. We're going to start taking our pictures now. Those are the blood vessels within the heart. Now we take several pictures of the same blood vessels from different angles, just to make sure that we're not missing any narrowings that may appear in one angle and not appear in another angle.
What does this actually tell you when you look at it?
Well, this is showing us how well the dye is moving through the heart's blood vessels, which gives us an idea of how well blood flow through the blood vessels.
So it's blockages and things of that nature?
Yes.
Amazing. I don't feel a thing.
We're about to take a picture of the heart's pumping chamber. This is going to show us how well the heart is pumping and therefore the strength of the heart. Typically, because we're giving an injection of a large amount of contrast, it's going to result in a warm feeling. And you'll feel this warmth really throughout your body. It will last about 15 to 20 seconds.
Everybody thinks it's kind of funny, yeah. You know, about somebody sticking a catheter up a vein and shoving it up through your heart and all of that, but you don't really feel a thing. It's absolutely painless. The only sensation was that feeling of warmth when they injected the heavy dose of dye into me. Then I got it was warmth, like somebody poured warm water on me, but that was it, nothing else.
Robert, we're all done. That's it.
Yeah, that wasn't bad at all. Nothing at all like I expected.
We're going to have the results in just a few minutes. We're going to review the final pictures and have the results really within the next 5 or 10 minutes. Robert, how are you feeling?
I'm fine. I feel fine.
Well, we've reviewed your pictures. You did very well during the procedure. Everything went very smoothly.
Good.
And what we have noticed corresponds to the abnormality on the nuclear stress test.
Well, Mr. Hatcher's cardiac catheterization demonstrated some moderate coronary disease in the blood vessel on the top and bottom surface of the heart, disease that can be treated medically. There was also some blockage in the blood vessel to the side of the heart, which appeared to be chronic.
that probably resulted at some point in the past. And it has also resulted in some moderate weakness to the area that that blood vessel serves, the bottom and the lateral surface of the heart. I think that that was all sort of predicted from the nuclear scan. Right. The good news is that the other blood vessels look very good. There's some mild irregularities, but no critical blockages.
Oh, good.
And I think with some cautious monitoring and some medications, we can proceed with the carotid surgery at this time.
Okay, nice baby, nice daddy. Let's roll.
Because baby Brandon must have blood drawn for constant testing, Chris will now insert a catheter in through the umbilical cord so the doctors can easily access his blood.
These are the catheters that are going to be threaded in to the both the artery and the vein in the baby's umbilical cord. This is what they look like. We have to send blood for a myriad of tests and things that we're constantly watching, and rather than having to poke a baby and cause pain all the time, we have access to central vessels really quite easily through the umbilicus, and we can put those in. It's a sterile procedure. You know, it's very controlled. It's done with sterile technique.
Since Westchester Medical Center is a teaching hospital, Chris takes this opportunity to instruct the student assisting her.
You want to get the clamp totally saturated, and the whole cord itself all the way down to the base and then around the skin. I'm going to just tie this around the base. No? Improvise?
Yeah, I did it.
Okay, then this, most important, is one straight slice through, start high in case we need to trim down more. Okay, one slight, straight, okay, cut. I'm going to get rid of this.
Once the incision is made, Chris and her assistant painstakingly insert the tiny catheters into the baby's artery and vein.
Let me hold this tight. Oh, you know what? You know what? Can you hold this right here in your hand? Because I think I'm at a good angle right here. See it? Then you have no idea how tedious. Praise God and say hallelujah. Okay, so this is your artery. Here's our vein, which has blood flow. Hallelujah. And then that's it. And then Dr. Z, you're going to write a procedure note? How we doing?
Doing good.
Put the lines in. So now we're going to get x-rays and take a look at his lungs, see how they look, and take a look, make sure those lines are in proper placement. Because we like to see that vein go above the level of the diaphragm, and it's a tricky line to place. So hopefully, you know, we got it. If we didn't, it's not a great big deal because we did get the artery, so we'll be hopeful that they're in good position. It's not just medical care that I give to these families. It's more than that. It's like a humane, you know, you have to give them psychological support, social support. I like for them to see me as a friendly face, a caring face, someone who they can come to for information, and maybe I won't have all the answers for them, but I like them to know from me that they're going to get honest information as the best that I can give. Okay? All right. Thanks. Keep you posted. Wow, it's excellent.
Yeah, so we cut down
14?
the rate. Cut down the pressure to 12.
14, good. To 12? We were at 16 then. Oh, she started around 12. Okay,
Yes,
very
we
good.
went up to 14.
Good news, we have a very good blood gas to start, so that's great. pH normal, CO2 normal, blood oxygen great. So it's looking good for Brandon so far.
Nurse Chris Casal begins her examination of baby Brandon. She's happy to discover he's further along in his development than was originally thought.
Let's see if he'll suck. There he goes. The suck is a reflex. It's one of the reflexes that we check for. It really is just it's a very subjective assessment based on a scale that someone developed as to the gestational age of baby. You woke up for that, huh? Take a look at his back. It looks at muscle tone, it looks at skin, it looks at genitalia, the development of the genitalia, hair on the body. It looks at nipple growth and development. It just looks at a bunch of really subjective things, and it grades them. And at the end, when you do this exam, you kind of tally up your points, and it'll give you a rough idea as to the gestational age of the baby. He's got a little bruise right here on ribs here, probably just from extraction. This guy is right now, I would call him appropriate for gestational age, so he's grown appropriately for the amount of time that he spent in utero. And it's sort of unfortunate for him that he was born a little bit early, but so far, I mean, he's off to a great start. We'll obviously watch him really closely, and obviously the first 24 to 48 hours are the most critical time. So he's looking at, I mean, there's a lot of things this baby has to do. The first thing he has to do is learn how to breathe and do it by himself. And then he's going to need to learn how to eat, and he's going to have to learn how to suck from a bottle and breathe at the same time. So there's a lot of milestones this baby has to reach. He has to maintain body temperature. He's got a lot of milestones ahead of him. First things first. He's only a few hours old, not even, right?
After his catheterization results have been reviewed, Robert is now ready for his carotid artery surgery.
Arteries on both sides, the left and right, are blocked. The right side is the worst, which is why when I had my stroke, that it affected the left side of my body, because the blood flow to the right side of the brain that controls the left side of the body. The blood flow was interrupted because of the buildup of plaque and various things in my veins.
Robert's surgeon is Dr. Pravin Shah.
He was admitted to the hospital with the stroke. And when they work up for the stroke, he had both the carotid has about 80% narrowing. And that's why the vascular surgery consultation was called by general practitioner. And that's how I met Mr. Hatcher.
Knife, please, just one more.
Dr. Shah's first step is to locate the plaque clogging Robert's artery.
We make an incision on the neck and then expose the carotid artery. Once those are exposed, the question comes whether we are going to able to clamp those arteries or not.
This is the internal carotid artery which goes to the brain, supplies the brain, and that's the culprit. The plaque is extending much more higher in the internal carotid artery, so we have to do that extra dissection. When we open this artery, you will see that? It's in the artery. You see that little stuff?
After locating the plaque, Dr. Shah carefully removes it from the artery.
How is it good? Okay, good. Okay. Talk to this, please. See, the plaque is coming out. Clear, please. Now, this guy is a very interesting case. He thought that maybe little numbness of the extremity may be related to something. He slept on his arm, and he did not go for medical attention. And suddenly he developed a major stroke.
So this is our cerebral plaque.
This is removed. This is a plaque. It was inside the thing. Think about it as a rusty pipe. You see, this was clogging the artery. And when you open it up, look inside how it looked. When you take out, the pipe is clean.
After several days of recovery in the hospital, Robert is finally going home.
I think his prognosis is very good. He's now aware of his vascular disease and will pay closer attention to the risk factors. So he's doing quite well. Without the surgery, he would have been at a higher risk of a recurrent stroke. That is clear. So clearly by having the surgery, he has hopefully reduced his chances of any further stroke and therefore any other disabling effects of a stroke. And hopefully now he will also prevent himself from developing further vascular disease in other areas.
The most satisfying portion is that you have taken the difficult challenge and you carry it through, and the patient does well, and that is most satisfying.
I tell you the truth, I was amazed at the fact that there was so little a little pain involved in everything. Even during the night, I didn't really experience any pain. After 5 days, I can go back to my normal routines, whatever they are, and I'll be back to some semblance of normal life. Thank you very much.
Welcome.
Close your eyes. Okay. Yeah, go ahead. I got the spotlight.
Spotlight's on.
Now you're in the spotlight, Chris. You better get it.
Baby Brandon's lungs are stronger than the doctors expected, so Chris removes his breathing tube.
All right.
It's coming out.
Just stuck on his lip.
You have
here.
a bag somewhere.
Start back a little further. There you go. See it back there?
Yeah.
There you go.
Hi. Hi. You're going to take a nice breath by yourself.
You have the little side things, Mike?
What we did is we took the breathing tube out. So all the work right now is being done by your baby.
Yeah. Oh, that's outstanding.
Yep. Okay.
Oh man, she's gonna be thrilled with you.
Yeah. We're going to treat him with a medication that we call Capsit. It's Capsit caffeine, actually. Caffeine is a stimulant, okay, that was going to help to prevent the baby from developing. Look at the bubblies blowing. How talented.
That's my boy.
The caffeine is going to sort of just help to stimulate his brain to help remind him to breathe, okay?
And he'll lose a little weight too,
Absolutely.
right?
Yep, we expect him to lose at least 10% of his birth weight within the next, 24, 48 hours.
Hey, buddy, don't lose too much weight, okay?
He's going to lose, and then as we start feeding, he's going to gain back. All right, so congratulations.
Thank you.
So far, so good.
It's looking good.
Yep.
I want my wife to come in and say she'll be happy.
Oh, yeah, I'm sure.
After 2 anxious days of not being able to see her son, Brandon's mother is finally well enough herself to hold her baby. And like most premature babies, Brandon has some jaundice, a yellowish skin color. The doctors treat his condition with phototherapy lights.
I hope he's going to be okay. I can't guarantee what his long-term developmental outcome is going to be. What I can say is he's in a pretty good shape just because he has escaped any devastating neurological event at this point. I think that Brandon's huge advantage is going to be his parents. They are on the ball with this kid, and he's going to be, protected and sheltered. And I really believe deep that that kind of parental intervention and response and attentiveness to a child really makes a difference.
Now we both have somebody that relies solely on us to, make it in this world, and it's a pretty cool feeling. Now we have a little guy waiting to come home, and we can't wait for him to come home. Grown men aren't supposed to cry,
Who says? It's going on everywhere, don't worry.
We're going to hope that every day for Brandon is going to be about gaining weight, getting bigger, learning how to suck, swallow, breathe, do all those things at the same time. Eventually to get out of this incubator and into an open crib and get out of here and go home.
Did he just make that noise?
Yes,
he did.
He's talking to me.